Healthcare is important to all of us. That's why we've invited our good friend Liz McPherson from United Healthcare to join us to discuss how you can make the most of your Medicare coverage in 2018. Welcome.
Thanks for having me back, Gina. So remember the last time I was here,
yes,
we were talking about the Medicare open enrollment period.
Exactly.
That was in the fall.
Right.
So this is not a time to forget about your Medicare. About 60 million people in America had a chance to make a change to their Medicare coverage for 2018. And a lot of those people chose Medicare Advantage plans because of the cost savings and some of the extra features and benefits. And I want to make sure everybody knows to use those.
Well, and that's what we're going to talk about. So I want to make sure I get this right. We're talking about staying healthy,
yes,
and saving money. Those
Absolutely.
are the two big things, right?
So that's my goal every year. Save money, lose weight, stay healthy. And I think everybody else feels like that as well. So when you're on a Medicare Advantage plan, you have a lot of extra features and benefits. Things like no-cost annual wellness visits, hearing aid benefits. You've got sometimes you've got your prescription drug plan included as well. Things like no-cost gym memberships are really a great benefit to have. How'd you like to have a no-cost gym membership?
That's a huge expense not to have.
And you know what? It helps people live healthier lives, so we do it.
Well, can I tell you that my dad goes to the gym every day? He started doing that was his New Year's resolution last year, and he does it now every day. And it's one of those things I think they do to stay healthy, right?
Good for your dad. That's exciting.
So then another thing we're trying to do is a lot of people are on fixed incomes. So, you know, really saving money and not spending it unwisely. That's key.
Absolutely. So original Medicare covers 80% of your Part B medical coverage, and that leaves you with 20%. Medicare Advantage plans have fixed copays, and they also have maximum out-of-pocket, so you can budget. You know every year in your worst-case scenario what your maximum spend would be.
Okay, so that helps you out. So you kind of go, okay, I can spend money here and here, and I don't have to worry about that. All right. So one of the other things that people can say is that, do you have any tips on, you know, when you have it all, you want to stay healthy, you want to save your money, but sometimes you also have to make sure that you're doing it the right way. You have to understand your plan in general. So what are some of the ways that you suggest folks really kind of are able to understand what they have?
Well, you know, you definitely want to know what your plan covers, because a lot of plans have things like, you know, discounts on vitamins, even things like hearing aids. You could save thousands of dollars with some plans that have these extra discounts. So you're going to want to read the literature that we send you.
So making sure that they read all the fine print.
Absolutely.
But you guys do a great job of making sure that that's out there. So in addition to many other people, and when it comes to prescription drugs, is there anything in particular that they need to know?
Yes. You know, prescription drugs, who doesn't take them, right?
Yeah.
So you want to make sure that if your doctor prescribes a generic, like that can save you a lot of money in many cases. So talk to your doctor about maybe changing from a brand name drug to a generic. Mail delivery is great, and a lot of times you can do 90 days, so you don't have to think about refilling that prescription for 3 months, which is great when you're traveling or if you've got a busy lifestyle. If your prescription plan has a network, you're definitely going to want to stay in network with that as well.
Yeah. Well, and I do know, I've learned too, that even with our prescriptions we have for the kids or whatever, if you go longer, you don't have to worry about making that trip too.
Exactly.
So that's one of those nice
Save
things.
yourself some time and some money.
Absolutely. All right. Now, additional resources. You guys are really good at this. I've always sort of touted you guys for having those additional resources where people can learn more if they have more questions.
Absolutely. So I like to tell people to go to MedicareMadeClear.com. They can also go to Medicare.gov or call 1-800-MEDICARE for more information. And you always have the phone number on the back of your ID card. You can call that 800 number and we'll help you out.
So if you're sitting there thinking, oh my gosh, wait, what did they say about that gym membership again? Or wait a minute, what? Or how can I get how many prescriptions?
Exactly.
In advance? Those are the type of questions people can definitely call.
That's what we're here to help you with.
Well, you make it very clear. We appreciate that so much. And especially when we were talking about my parents, I know I told you that going to the gym is something that they're learning to do. But as an adult, you know, having an adult child, being the adult child rather, having your parents understand these plans, not just about the enrollment, which we've talked about before, right? But actually having them understand these plans. If you're out there and you're the adult child or someone trying to help your parents, it's important that they listen to what we're saying too.
Well, and you know, Gina, we have a new program called Navigate for Me, and this is designed for our members with complex health issues, things like diabetes, congestive heart failure, Maybe you've just had a stroke or a heart attack and you got out of the hospital.
Right.
And you know when you're in that clinical setting, everything is taken care of for you. And then you get home.
Yeah.
And you don't know which direction to go. Yeah. So we partner health navigators with our members with these complex health problems. And they're going to help them with things like a care plan, making doctor's appointments, even things like helping if they have a claim issue.
See, that is so helpful.
It's like having a kid in the healthcare business.
Liz, thank you so much.
Thanks,
Let's
Gina.
remind folks that if you're enrolled in Medicare, take time to learn about the programs and services that may be available to help you meet your health and budget goals. You can learn more at MedicareMadeClear.com or Medicare.gov. You can also call your Medicare plan directly at the number on the back of your ID card. Thank